So sad news the other day as Tiger Woods, of all people, tweeted out on Monday that he's getting professional help to manage his medications in the way that he deals with his back pain and sleep disorder. I say Tiger Woods, of all people, because, boy, this is the very public face of the opioid and pain medicine addiction that we're seeing in this very country. And I'm so pleased to be welcoming an addiction expert to this program. From Taylor Recovery, it's our friend Ryan Davis. Ryan, welcome to WHO WMT in Iowa. Thanks very much for taking the time.
Oh, of course. Thanks for having me on this morning.
So, Ryan, just to open up, how easy is it to get addicted to pain pills?
So it's super simple. It's very easy just to go to any doctor and tell them that you're having back pains or anxiety or anything like that of that nature, and they write you a prescription of pain pills. And you get home with these pain pills, and the pain's so strong, and you can't deal with it, that you start to take it more than it's prescribed, and it's that simple to get addicted to them.
And isn't there a point, Ryan, I would assume, because we have been talking on this program about the opioid crisis, where there's a point where the doctor says, okay, you shouldn't be in pain anymore. Let's say I was getting prescribed because of, as Tiger Woods was saying, for his back pain, and people still are craving that feeling, the numbing of the pain. Is that what's happening psychologically with people, Ryan?
That's exactly what's happening. And then, so when it gets to that point and the doctors, stop prescribing the pain medicine, they start to, transition into using the cheaper street cousin, which is heroin, and they start to get addicted to heroin and things like that. Or the pain medicine gets too expensive for them to buy. The insurance stops covering the prescriptions and things of that nature. So they start transitioning into harder drugs, which becomes an even bigger problem.
Well, and Ryan, I guess I'm sure a lot of listeners are wondering this, because we're all going about our lives and we're hearing that so many of our friends and neighbors are becoming heroin addicted. Where are they finding it? When you say, okay, I can't get the pain pills anymore, do you hit a local night spot and go looking for it? Do you have a friend at work? What's the source for, common working class folk to be getting heroin these days?
So heroin's becoming such an epidemic in our country, and I mean worldwide even.
Yeah.
You can go to almost any gas station, you go somewhere, basically anywhere, nightclubs, like you said, gas station, you start asking around. People even just come up to you and ask you if you're looking for something. It's that easy. That's why it's so prevalent these days. It's everywhere. So that's why it's not gonna, our highest CEOs to, people just off the street can find it without any problem.
So, Ryan, what would you say the role in this of doctors and pharmacists? We're becoming more aware as a nation of this problem. What role do they play?
So the doctors the role that they play is they're overprescribing. Okay. And some of them are just writing scripts just to write them without doing their due diligence and researching if this person actually needs it and their medical history. I have clients here at Taylor Recovery that their main thing on the streets was they would doctor hop and just go to each doctor and make them write a different prescription. And these doctors aren't even caring what their medical history really is. So the doctors have to be more aware and do their research on each client and see if they really need these drugs before they prescribe them.
And do you find now when you're talking to your patients and you're also talking to doctors, are they starting to try to find alternative treatments for pain given the problem that we're now seeing across this nation?
Now, some doctors are. There's different medications that aren't habit-forming and are less addictive that doctors are prescribing more and more these days. And we're seeing that more and more here in Houston. So that's what we need to lean towards more than the stronger opioids that are being, prescribed for pain. So doctors are becoming more aware. And I've noticed that they started to ban some of these, stronger pain medications, which is the right direction. And we need to keep going and moving forward into that direction, to overcome this horrible epidemic.
So, Ryan, you're at a 70-bed addiction recovery center. What percentage of your patients right now do you think are hooked on opioids?
90%.
90%?
Yes, 90%. It's gone are the days where it's alcohol and cocaine, being the big things here. It's all heroin and oxycodone and, all opioids. And the other 5% is probably meth use, and the other 5% is probably alcohol. But definitely the overwhelming number, 90%, is opioid addiction.
And Ryan, when did you start realizing that there was specifically an opioid problem? As you said, we think of alcohol, we think of meth addiction. What was the turning point for you where you looked around and went, man, opioids, this is a raging problem right now in this nation?
Well, the big turning point was when I start seeing so many people overdose, or reading in the news that so many people are overdosing from, heroin and overdosing from these big opioid painkillers. And that's when the big problem arose, and people coming into our center addicted to heroin and all of that. So it's been a couple of years now. It's been like that for about 2 years, I'd say, that it's been mostly opioids. And, man, when I tell you, when that heroin grabs our clients, it's super hard for them to get off of it. It is just ridiculous.
Well, and you anticipated my next question, Ryan. What's the treatment like? What are you guys doing that's leading to some success?
So we have this intensive outpatient program, and they go through intense processing 3 to 4 days a week. They have individual counseling as well. And then there's also a medication that, some of our clients use that are helping with their cravings and helping them to stay off of the opioids. It's called Suboxone, and it's really been helping them. We see it as a lesser evil for sure than them putting a needle in their arm, and it's been helping them tremendously. And our counselors are amazing, and they spend a lot of time with our clients to help them overcome their addiction. So just a bunch of intense processing and group sessions and just talking about their addiction and the struggles that they're having. That's what really helps these clients. Yeah,
because I want to get in their head for a moment, Ryan. Obviously, if the pain that they were originally prescribed for, let's say they had back pain, and that's gone away, what is overall, why are people continuing to medicate themselves? Do they just like that feeling of numbness?
Yes, so most of our clients, they like the feeling of numbness, and some of them just aren't okay with themselves. You know what I'm saying?
Yep.
They like to change the way they feel, or, they have low self-esteem, and they're very socially awkward, and they feel like drugs help them to be more socially conscious and help them be more outgoing. And so that's where, it's really, once you get addicted to a drug, it's really hard to get off of because of those reasons. You become a totally different person, and their reality is so warped at this point that they think that's who they really are, and that's the better person for them to be while they're addicted to drugs.
So let me ask you, I've also been reading, you're at Taylor Recovery, Ryan. Are you guys using pets? That's becoming a part of the therapy, isn't it?
We are. So we're pet friendly. We allow all sorts of animals, dogs, cats, birds, snakes even. And it becomes it's very therapeutic for our clients. It gives them a sense of self-worth, and they're taking care of an animal, and, the animal brings them a sense of calmness, and, they're not as anxious anymore. Or, it just gives them something to look forward to each day to take care of their pets. And a lot of people in their addiction, they won't leave their pet. If they have a pet already, they won't go to treatment without their pet. So we feel like, why not allow them to bring their pet with them, to help them out, if that'll help them get better and overcome their addiction. So it's a big, big tool, to use in the addiction field, and we think it's been working very well for us.
That's really interesting, Ryan. And I know it made people laugh to think that having a snake might be calming to some people, but I imagine it's the caretaking, right? If you're caretaking a snake, you're a happy person.
That's right, man. And a snake's just like any other animal. You know, there's people who like different exotic animals.
Right.
They, you know, like myself, I have a dog, and the next person next to me might think that their snake is just as important to them as their dog is, as my dog is to me. You know?
Who are we to say, right? Who are we to say?
Exactly.
That is absolutely that's really, really interesting. Ryan Davis, this has been so helpful, so much good information. Thanks for taking the time to talk to me
today.
today.
Thanks so much for having me on. I really appreciate it.
Yep, no problem at all.